Okay, this is a community group project on the topic of dementia from Sutter Tracy Clinical Group members, Jarnisha Jones,
Maria Cervantes,
and Chan Yu.
Dementia is a syndrome most often characterized by the dysfunction or death of brain cells in different areas of the brain. According to the Center for Disease Control and Prevention, dementia is not a specific disease itself, but rather a set of symptoms with slow and progressive process changes of varying systems, stages, and types. Now, memory loss is the most common symptom, but it may also include some behavioral changes, language impairments, inability to solve simple problems, and in its latter stages, individuals may even exhibit some psychiatric symptoms, which will affect a person's ability to assume previous roles and capabilities. And this flow diagram is the pathophysiology of dementia. It serves to elaborate on the structural and chemical alterations in the brain caused by neurological deficiencies that is medically termed as neurodegeneration. Now, neurons are the building blocks of the nervous system, which include the brain and the spinal cord. Neurons normally don't reproduce or replace themselves, so when they become damaged or die, they cannot be replaced by the body. As you follow the pathways, you can see the neurodegenerative changes occurring in the brain and how the nerve damage impacts daily functioning. Dementia is an umbrella term used to describe a variety of conditions that cause changes and damage to the brain that result in the impaired ability to remember, think, or make decisions that interfere with doing everyday activities. There are over 100 different types of dementia that have various causes, including the progressive and irreversible neurodegenerative dementias like Alzheimer's dementia, vascular dementia, Lewy body dementia, frontotemporal dementia, and mixed dementia. It is important to note that there are other disease-related conditions that are associated with dementia, including Parkinson's and Huntington's disease. The most common form of dementia is Alzheimer's disease. This disease accounts for 60 to 80% of all dementia cases, according to the World Health Organization. It is a chronic, progressive, incurable mental deterioration with no known cure or way to reverse its effects at this time. The common symptoms of Alzheimer's include trouble remembering recent events, like conversations that just occurred a few minutes ago or even hours ago. And as the disease progresses, individuals have difficulty recalling their long-term memories. If you have a family history of Alzheimer's, so let's say your first-degree relatives, such as your mom or your dad, have had Alzheimer's, it increases your risk of developing Alzheimer's by at least 10 to 30%. Now, in this slide, it's just a representation that is a highlight of the information on the various stages, symptoms, and progressive duration of Alzheimer's disease. So it's important to review this information since Alzheimer's does account for up to 80% of all dementia cases. Vascular dementia is the second most common type of dementia. In vascular dementia, changes in thinking skills sometimes occur suddenly after a stroke. Now, stroke can block major blood vessels in the brain, causing inadequate blood flow. And inadequate blood flow in any part of the body can damage and eventually kill cells very quickly. And the brain is especially vulnerable in this area. Vascular dementia is linked to strokes, and it accounts for about 10% of all dementia cases. This type of dementia progresses in a stepwise fashion, meaning that thinking difficulties may begin as mild changes and they gradually worsen as a result of multiple minor strokes or another condition that affects smaller blood vessels, which leads to widespread damage. Now, a growing number of experts are actually using the term vascular cognitive impairment instead of vascular dementia. So you might see or hear that term used interchangeably with vascular dementia. People with diabetes, high blood pressure, and high cholesterol are all at risk for contracting vascular dementia as a comorbidity. Lewy body dementia is the third most common form of dementia. It accounts for up to 10% of all dementia cases. It is caused by an impairment in the Lewy bodies, which are alpha-synuclein proteins that are found widely distributed throughout the brain. Lewy body symptoms include impairment in movement and balance problems. Now, someone might have a hunched posture, rigid muscles, a shuffling walk, and trouble initiating movement. As it progresses, you might also see changes in alertness. So people might sleep more in the daytime, and they may even have spells of confusion. So Lewy body dementia has symptoms that overlap with Alzheimer's disease and Parkinson's disease dementia. So people may be diagnosed with one of those types of dementia when they indeed have Lewy body dementia. And with Lewy body dementia, doctors are primarily looking at impairments to physical movements as opposed to changes in memory, which occurs in all of the various types of dementia. Now here's Maria for more.
Thank you. Okay, so on this slide, we have frontal temporal dementia. This type of dementia affects the frontal and temporal lobes of the brain, which are highlighted in blue on this picture of the brain on the slide. These parts of the brain atrophy, which means to shrink, in a person with frontal temporal dementia. Nerve cell damage caused by frontal temporal dementia leads to loss of function in these regions, and because of this, leads to changes in personality and behavior, because the frontal and the temporal lobes are generally associated with personality, behavior, and language. People with this condition can engage in behaviors that are embarrassing, behave inappropriately, or have language deficits. These actions or deficits are not controllable by the person, and many lack inhibition, which is what causes them to say inappropriate things or act in ways that one would normally not act. Okay, next slide. Okay, so here we have other dementias. So sometimes more than one type of dementia can be present at a time. This is most common in people over the age of 80. This can happen because, again, dementia is a general term, which could mean the loss of memory, language, problem solving, or any other ability which could interfere with daily life. For example, you could have Alzheimer's dementia, which is the most common type. And you could also have vascular dementia along with that. Maybe the person had a history of hypertension, which led to that vascular dementia as well. Parkinson's disease is a movement disorder, but as the disease progresses, it can cause Parkinson's disease dementia, which is characterized by a decline in thinking and reasoning. This can occur as early as a year after being diagnosed with Parkinson's disease. Huntington's disease is an inherited genetic condition that causes dementia by affecting the central area of the brain, which causes involuntary movements, severe decline in thinking and reasoning skills, irritability, depression, and other mood changes. Next slide. So what do the cognitive changes of dementia look like? In order to identify a problem, you need to know what to look for. The next slides will provide information on common signs and symptoms of dementia, as well as the different stages of dementia. Next slide. So here is a nice sign from the Alzheimer's Disease International, which gives 10 warning signs of dementia. As you can see here, there is 10 of them. The first one would be memory loss. You know, perhaps you forgot an appointment or you missed a deadline for something. You can have difficulty performing familiar tasks. You know, say you want to work your washing machine. You've worked it all the time, but for some reason you can't remember how to do it. You can have problems with language. Maybe you can't remember a word during a conversation. disorientation to time and place. Perhaps you're driving, you become lost, and it's a familiar route that you've taken all this time. Poor judgment or poor or decreased judgment. Maybe you walk outside in a tank top when it's -10 degrees outside. You can have misplacing of things. You know, maybe you can't find your keys. Yes, this happens to a lot of us, but maybe you can't find them because you put them in the freezer type of thing. And then, you know, you could read the other ones on this page. It's very helpful, just things to look out for, which will make you think, oh, wait, I think I should talk to my doctor about this. Next slide. Okay. And here we have the early stage of dementia. So this is what you can normally find in this stage. In this stage, you have problems that are mild and almost unnoticeable. This can be especially true if you are living alone and don't have anyone observing you most of the day. Symptoms vary depending on the area of the brain the disease affects. For example, Alzheimer's disease affects the area causing memory loss. In FTD, there is a small typo on here where it says PTD. It should be FTD, which is frontotemporal dementia. And this type of dementia causes behavioral changes. So you might start to see changes in the behavior. And sometimes symptoms may be dismissed and may be thought of as normal aging. Next slide. Now here we have the middle stage. In this stage, changes in the person with dementia are more obvious to the people close to them. Relationships and daily life are affected by the changes. They have a hard time accomplishing everyday tasks. People in this stage can become frustrated, angry, have mood swings, and conflicts are typically common during this stage. They can have suspicions or become uncooperative. So people in this stage often accuse others of taking their things. This is usually because they cannot find them. Maybe they misplaced them, they just don't remember where they are. And it's typical for them to place objects where they don't belong, which leads to the suspicion of maybe somebody took them. And of course, this behavior can be stressful for caregivers. Next slide. Okay, so finally here we have the late stage. People in this stage will need help with activities of daily living, so ADLs, because they cannot do it for themselves anymore. They will have loss of facial expressions and be unable to speak or tell you what they need. Walking or sitting up will require assistance, and people in late stage dementia will eventually be bedbound and require around-the-clock care. Next slide. So what are the risk factors for dementia? Age is the strongest known risk factor for dementia. Most cases affect those over the age of 65. Of course, younger people can get dementia, but this is rare and only affects about 5 to 6% of people under the age of 65. Family history, those with a family history of dementia are more likely to develop dementia themselves. Race and ethnicity also increase your risk. African Americans are twice as likely as whites to have dementia, and Hispanics are 1.5 times more likely to have dementia than whites. Also, having poor health puts you at an increased risk as well. High blood pressure, high cholesterol, history of smoking, all have been linked to dementia, especially vascular dementia. Traumatic brain injuries, especially if severe or occur repeatedly, increase the risk of developing dementia. Right, and it's off to Chan now.
Okay, so here are some medical terms used in the medical, hospital, or healthcare settings to describe dementia-related changes that one might hear. We have aphasia, which is the lost the ability to understand or express self-speech, which is the deterioration of the language function. We got apraxia, which is impaired motor function, inability to perform a movement on command. For example, picking up a spoon, they can comprehend the action, but they just are unable to perform the action. Then we have agnosia, inability to recognize names of objects or people. Then executive functioning, which is the inability to think abstractly, having difficulties in such as recognizing patterns, analyzing ideas, synthesizing information, or just solving problems. And then 5, lastly, just amnesia, which means just the loss of memory caused by brain degeneration. Next slide. So who is affected by dementia? It is estimated that 5.8 million Americans who are 65 years of age or older are living with dementia of the Alzheimer's type. Almost 2/3 of those are women. Family caregivers are often referred to the invisible second patient. They are critical to the care of a patient with dementia. There are about 15.7 million family caregivers in the US providing care for a family member who has been diagnosed with dementia. So, and here's a attached video from YouTube, less than 2 minutes. The video shows the facts and numerical figures on the impact of dementia and Alzheimer's from the Alzheimer's Association. Next slide. So this slide, it just shows dementia for people in limited resource community. So if you live in an area where there are limited resources regarding dementia, there are many organizations that provide services and support. And then these are the links that of a few organizations that can link to their websites that can help those in need. So we'll put the links in the video or the tab below for you guys to check out. Next slide, please. So this is dementia's national and global impact. So the older adult population of Americans 65 years and older has increased by 8.8 million or 24.7% between 2003 and 2013 to number 44.7 million people, and is expected to continue to grow approximately to 79.7 million by 2040. Conditions related to dementia are primarily impacting individuals aged 65 and older and are expected to affect 14 million people in the US within this population by 2060. Currently, there are 50 million cases of dementia throughout the world. Dementia is the 5th leading cause of death, with about 10 million new cases of dementia reported each year. Healthy People 2020 has dementia related goal to reduce the morbidity and costs associated with and maintain or enhance the quality of life for persons with dementia, including Alzheimer's disease. Next slide. Okay, so here in this slide shows a 10-minute video TED Talk, very informative, of Professor Henry Brody, who is a researcher, clinician, policy advisor, and a strong advocate for people with dementia and their caregivers. The video informs on preventative measures for dementia and ways to enhance the brain health. Also teaches on healthy diet effects and factors that can reduce the risk of obtaining dementia. So we'll also put that link for the video. Next slide, please. So this slide, providing support for those with dementia and their caregivers. So this one is Speak Up. Okay, so the Speak Up community. Where was it? Slide 20, hold on. Okay, for here, sorry. So this slide is a resource for local and national organizations that can help individuals and their families or caregivers. It's to help bring awareness and support for dementia. So the Joint Commission, whose primary objective includes quality improvement and patient safety in healthcare, has developed the Speak Up campaign that provides facts about memory problems and dementia, identifies when to seek help, teaches questions to ask your doctor, provides advice for members. And also, if you look on the right-hand side of the Speak Up slide, you see all the links and websites that you can go under to seek help or resources for dementia or the Speak Up program. Next slide, please. So providing support for those with dementia and their caregivers. So when caring for someone with dementia, it is important to try to understand the impact their condition may have on them. People with dementia can have decreased confidence, self-esteem, loss of independence, and autonomy. They also go through the loss of social roles and relationships. They may lose the ability to carry out some of their favorite hobbies or activities. When a person is diagnosed with dementia, the family members who will be caring for the patient should begin to prepare themselves for what will come. They should begin by learning all what they can do about the disease and how it progresses. Family members should get together and plan the tasks that each will accomplish, such as the health and financial decisions, who will provide care, who the patient will live with, etc. A personal support plan should also be planned to help support the caregivers and the person with dementia. So provide emotional support to and the family members. And then also for dementia, so you want to also let the patient with dementia, let them express their feelings regarding the condition. You want to teach them about the disease process and refer them to social services and support groups if available. You want to understand the changes that the person will go through to help provide care for them as you anticipate the changes that may occur. So next slide. So this is just additional resources available in the San Joaquin County. You can just read that. There's also a link for resources and extra support. All right, so next slide. So reflection on the research for the entire group. What we learned from our research is that dementia is an umbrella term. Many causes dementia, but it is not a disease, but a group of symptoms that varies. Another thing that we also learn is that dementia is a democratic disorder. It affects all races and all countries, doesn't matter gender or sex or anything. And then preventative, we also learn to prevent dementia. We can't prevent dementia, but we can prevent the onset with exercise, nutrition, and just strengthening your brain function. We also learned that there's no cure for dementia, and then also incorporate education within individual, clinical, and also population. So how will we use this in clinical settings? So for us nurses, we will want to identify the common symptoms related to dementia. We want to identify as early as possible so we can be able to, treat the symptom conditions and delay the onset. And also, we can also reduce the risk of patients or people from developing early dementia. We want to educate the importance of exercise, nutrition, and brain health. We also want to demonstrate the effective ways of listening to and communicating with someone who has dementia. Always want to provide all sorts of safety measures and prevent any injuries. Understanding that each patient with dementia are not the same, treat them wholesomely with holistic care, like one would treat with everyone else. Understanding to provide palliative care rather than trying to cure the patient. We want to provide comfort for the remaining of their life and provide the highest quality possible for people with dementia. Lastly, we want to recognize and encourage each patient's ability, not just people or with dementia, but everyone, to grow, connect, give, receive, and teach one another. So this concludes our PowerPoint, our project for dementia. Thank you all. From Jan,
Janisha,
And Maria.